Good evening, everyone. This is Shagnik, the designated moderator from ClearNet for this session. ClearNet is very proud to be a part of this webinar as its digital partner. We are already 7 days in this new year, but still a happy new year to everyone present here. Before we start the session, I would like to play a short video of ClearNet. Thank you all for your patience. As we all know, ClearNet is India's largest live digital CME and doctors generated medical content platform, which is exclusively free for all the medical practitioners. You all are requested to visit our website www.clearnet.com, where you can watch lots of live sessions conducted by expertise doctors all across the globe. We also have MedWiki, which is actually a kind of medical Wikipedia exclusively just for doctors. We are very grateful to this association and the star-studded panel with such highly affiliated doctors to be associated with us today on our platform. Now, without further delay, I would like to hand over this session to Dr. Surya. Dr. Surya, if you are present here, you may proceed.
Yes, thank you. Very good evening to everyone here. I'm Surya, your host for this evening, and it gives me great pleasure to welcome you all to the webinar on next examination, Challenges Ahead, organized by Indian Medical Association, Medical Students Network, and Junior Doctors Network of Tamil Nadu, Medusane, and HEDAL, Health Data Lab. Moving on, the next examination is a new milestone in the healthcare system of our country, aiming to build a more skilled and more efficient medical fraternity, in turn raising the standard of living for the population of our country. But the uncertainty among its implementation is frankly agonizing to the medical graduates. So to clear up all these dilemmas and to guide us blooming medical students and graduates, we have our esteemed speakers who are eminent personalities in the medical field here with us today. Before we begin today's session, I'd like to thank our patrons, Dr. Sendamil Pari sir, State President, IMA Tamilnadu, Dr. NRTR Tyagarajan sir, State Secretary, IMA Tamilnadu, and Dr. Alaga Venkatesh sir, Finance Secretary, IMA Tamilnadu, for their support and motivation in organizing this valuable webinar. To commemorate today's session, I would now request our Dr. Raghunandan Ramanathan sir, Convener, IMA MSN TNSV, and National Joint Secretary, IMA MSN, and member of the organizing committee to deliver the welcome address. Over to you, Doctor.
Thank you, Surya. It gives me an immense pleasure to organize this important webinar at this point of time. Good evening to all the dignitaries over here. Myself, Dr. Raghu, intern from Tagore Medical College and Hospital, State Convener of IMA MSN Tamil Nadu. In this landmark webinar organized by Indian Medical Association, Medical Students Network, and Junior Doctors Network Tamil Nadu State Branch, I am extremely privileged to welcome our patron, State President, IMA TNSB, Dr. Sendamil Pari sir, Dr. NRTR Tyagarajan sir, and Dr. Alaga Venkatesh sir, Finance Secretary, who will be joining with us shortly. It's my honor to welcome our guest speaker for today's session, Dr. Geeta Lakshmi ma'am, Vice Chancellor of Dr. MGR Education and Research Institute, former Vice Chancellor of Tamil Nadu MGR University, who was a very dynamic person and who was long-term associate of our IMA MSN Tamil Nadu. We had our first MSN meeting in Tamil Nadu MGR University campus in the presence of our esteemed chief guest of today, Dr. Geeta Lakshmi ma'am. I'd like to welcome Dr. Kanagasabai sir, retired Director of Medical Education and former Vice Chancellor of Bharat University, for this wonderful webinar. Thank you, sir. I welcome Dr. P. Sampath Kumar sir, Senior Police Surgeon, Professor and Head, Department of Forensic Medicine and Toxicology, Savitha Medical College, and President of Tamil Nadu Medico-Legal Society. I welcome Dr. Ariyaran sir, Chairman of Dr. Aran's Medical Clinic and Consultant of Glens Global Hospital and faculty at PACES. He is very much like a well-known person for MRCP training, and I welcome him for today's session, sir. And I would like to welcome Dr. Shiv Joshi, sir, Convener of IMA JDN Headquarters. And we will also have shortly with us Dr. Jayalal sir, past President of IMA Headquarters and current General Secretary of Commonwealth Medical Association. Thank you, sir, and thank you all for joining with us today. The National Medical Commission has announced this next exam. It was designed to provide authenticity to MBBS first draft on 28th of December. All the candidates who are aspirants for the postgraduate examination are like in a state of confused without clarity about the next exam, which is going to be taking place in 2024 as proposed by the National Medical Council. And here it's our duty as a Indian Medical Association Medical Students Network, Tamilnadu State Branch. It's our duty to clarify the doubts among the students, among the candidates who are aspiring to clear their postgraduate entrance examination and enter their post-graduation. So this day will be remembered in the history of MSN as we have eminent panel of speakers who will be clarifying all your queries today. And at the end of the day, we will definitely have some clarity about next exam. And as you all know that the authorities have appealed to the candidates to share their suggestion regarding the proposed next exam. And at this end of meeting, we will also compile all the suggestions taken from our eminent faculties over here as well as from the audience, which will be compiled by our chairman, Dr. K.M. Abulasan sir, and it will be shared to all. Thank you once again to Dr. K.M. Abulasan sir, who is always a motivational factor for us and who has encouraged us to conduct as many webinars as possible and academic events in the period of this 1 year. And this webinar under his supervision, under his chairmanship, we are here to conduct this webinar. Thank you so much, sir, and thank you once again for everyone.
Thank you, sir. Now I humbly request our Dr. Venkatesh Karthikeyan, sir, State General Secretary, IMA JDN TNSP, to address the audience.
Thank you, Dr. Surya. Very good evening, everyone. I'm delighted to be a part of this much needed discussion that is about the next examination. So the mere number of participants for this webinar, that is about 1,700 participants, shows the importance and the felt need of this topic. We are conducting this discussion under the leadership of senior IMA leaders like Dr. Ashokan sir, our National President-elect, Dr. Jailal sir, Dr. Sendamal Pari sir, our State President, our Secretary sir, Dr. NRT Tyagarajan sir, and of course, the most important, our ever supportive and dynamic State President-elect, Dr. Abulasan sir, who is always our motivating force and guidance. We have wonderful speakers like Geeta Lakshmi ma'am, who is my former Vice Chancellor, Dr. Jailal sir again, who is ever supportive for students and young doctors, and under whose presidentship MSN and JDN has seen new heights. Dr. Sampath Kumar sir, Dr. Kanagasabai sir, the former Director of Medical Education, Dr. Hariharan sir, and last but not the least, my mentor, Dr. Shiv Joshi sir. Our IMA JDN Tamil Nadu and MSN Tamil Nadu has constantly worked for the benefit of young medicos. We have conducted more than 60 academic activities in the past 2 years. Even tomorrow, we have an online conference about healthcare entrepreneurship for which more than 3,000 doctors across the country have registered. So we keep on conducting such sessions, which is beneficial for young doctors. Our IMA JDN and IMA MSN is taking this opportunity to invite all of you to join IMA JDN, to take IMA JDN membership, the fee of which is just 10,000 rupees for lifetime membership, which again can be paid in installment of 2,000 rupees spread over 5 years. So once you complete paying this 10,000 rupees, you will be a lifetime member of National IMA and the State IMA. In later part of your career, you may pay the local branch fee and get affiliated with the local IMA branch. For further details, you may just type IMA JDN membership in Google and you'll be taken directly to the IMA website where you can take JDN membership directly online. So with this, I would like to thank Dr. Raghu and others for giving me this opportunity. And on behalf of JDN Tamil Nadu, I welcome all and I believe that the next 2 hours will be of great benefit for all of us. Thank you, everyone.
Thank you, sir. Now let us begin with the most awaited speeches from our esteemed guests. I would like to announce our first speaker and introduce him. He has received many awards, including the Vikas Ratan Award by IIFS New Delhi, Best Citizen of India Award by IBS New Delhi, International Gold Star Award by NRI's Forum, London, UK, a word of appreciation from the great social worker, Mother Teresa, C.T. Thakkar Award by IMA New Delhi, Best Doctor Award by TNMGR University, Chennai, Honorary Professorship by IMA Academy of Medical Specialties. He is the chairman and consultant at City Hospital, Erode, and is the president-elect IMA TNSP and the chairman of IMA MSN JDN TNSP. our youthful and energetic Dr. K.M. Abdul Hassan, sir. I welcome you, sir, to speak upon the topic, Understanding NMC Guidelines for Next. Over to you, sir.
Thank you, Surya. Good evening, my dear friends, my dear boys and girls, all the faculties. I welcome everyone on behalf of IMA MSN TN and JDN TN. It is, it will go, this particular meeting, with the help of all the office bearers of MSN JDN, will go a long way in the annals of IMA, that we have discussed most important aspect in today's India. India is, of course, discussing more about education now after the introduction of national education policy. And you all know that there are going to be changes. There are going to be very drastic changes in the school curriculum, college curriculum, number of years for undergraduate, postgraduate, everywhere. Now the government also announced that it is going to change the study pattern of medical colleges across the country by introducing this next. When we heard this first time about 4 years ago, maybe 4 years ago, there was some panic. Everybody was panicked that it is going to impact adversely on the medical profession. Now we have learned that the uniformity of standard in all the medical college, of course, is necessary. There are so much of gray areas to start with. Now everything is getting cleared, and that's why government has come to the people, to the doctors, putting the draft of the next exam and asking suggestions. That's why this meeting is all about. You all know that next has got 2 parts. Next step 1 and step 2. The step 1 is more important, that it is replacing the final year examination and is going to be the examination of pass to do CRRI, to get license here to practice, and also the marks are important for PGCL. The 3 components are there in step 1. In addition to this, people have to take Viva Voice and clinical examination of the college soon after the next one. After that only, that will be pass and fail. After that only, they will be doing the CRRI. After that, they will have to take step 2, where again it will be pass and fail. So the objective of this particular pattern, maybe it is obtained it from other, universities in the Western countries, UK, US, and Australia also, to have a uniformity in the standards, the minimum standards of medical education in the country. And it is said that it is going to revise study pattern of students in medical colleges. But to me, it is a big change, it is a big change. All of a sudden, if it is introduced, and that will have a kind of difficulties in complying with the rules and regulations. So I always think whether maybe the faculties can come out, but whether this can be introduced in stages instead of all together, maybe one by one, step 1 first and step 2 next, something like that. Maybe that is one suggestion we can make. We'll discuss about it. And another important thing, query before us, it may be too early for a medical student to decide about, getting into PG or writing a PG examination kind of thing, the final year itself, when you had not decided, when to do PG and what PG to do. That is another important thing I think we will have to see. There is a third thing. There are so many batches who had finished already MBBS waiting for PG, and it is already addressed that issue that the NEET PG exam will be slowly phased out. I would like to know whether it will be run parallelly along with the next, and how long this NEET PG, because this is an important thing will be going on the minds of so many thousands of MBBS graduates who had already finished, came out of the campuses. this one important area, we will have to give some suggestions. And also, this people have to revise all the subjects for step 1 in the final year. They'll have to study, revise all the 19 subjects at once. It will be a huge challenge. So many entrance exam coaching people may enter into the campuses. So the campus ecosystem may have an adverse impact. This is another area we'll have to discuss. So though it is, uniformity is very important. And another challenge I feel that, in majority, right now, there is no uniformity in education across the colleges. That's why this move is on. But we will have to improve the infrastructure of all the medical colleges, the faculties of all the medical colleges, the education, everything. Then if they take this exam, then it will be fine. There will be a level playing field for all the students who are studying in different colleges. For example, people studying in AIIMS and JIPMER, all those people may be scoring more than the other college students. Just for example, I'm telling. So, but in due course, there will be, uniformity will be there. But in the initial 10 years, is what happened in a NEET examination. When it was introduced, NEET UG, there was tough resistance back here in Tamilnadu. Those studied only CBS syllabus, they got a good score in NEET UG examinations. Others were not. So slowly that things have changed now. Like that in next also, the level playing field will happen, but it will take some time. So there will be, till that time, there is advantage for the people who are studying in the highest medical college centers. These are the things I think we will have to put our brains together, because the government itself is having no clarity in some areas. That's why they have come for suggestions. So it's a wonderful thing that people, our particularly boys, students, are so eager to discuss this subject, because this is going to be the future of the younger medical generation. So I think we will compile all the suggestions, build a consensus, and send the resolutions to our parent Indian Medical Association. And I also see that there is another problem cropped up, that with regards to the NEETPG now. NEETPG, there are so many of our undergraduates who are finishing CRRI in Tamil Nadu, in many other states also, will not become eligible for this NEETPG this year, because many of them, they will not be finishing CRRI by March 31st. So that is eligibility criteria. So that also we will address. We will take it up very seriously through IMA platform. We will address. So I wish all the delegates who joined this important webinar have a very good day with very good suggestions coming up. And of course, as Raghu said, we will compile everything and IMA. We will hopefully, you will see good things are happening, and our concerns are very much addressed. Thank you. Thank you for the opportunity.
Abul, I was set up in Abul.
Yeah, Jalalji, welcome.
I was in a flight and I just landed, and unfortunately there was a huge delay has happened in the flight, so I couldn't connect you. I'm just traveling by the car. Thank you. I'm sorry I missed this very important meeting.
No, it has happened. You can, if you are ready, I will, Raghu, if you will have to attend another meeting, isn't it?
No, I will just, now the meeting is going on, or?
Yeah, it's just started, sir.
Just begin. That's why I called.
Okay. Go ahead.
Please stay online. I will invite you.
Sure.
Surya, please take note our immediate national past president, Dr. Professor Jailal has joined. He's online.
Yes,
you invite him when his turn comes.
Sure,
I have my introduction speak from my table. Whatever I said, I can go and invite other speakers, so that we will have more number of suggestions come up and also note down it. Thank you, Surya. Over to you.
Thank you, sir. Thank you, sir, for the very highly informative speech. Up next, I would like to introduce our next speaker. She is the Vice Chancellor of Dr. MGR Educational and Research Institute, University, Deemed University. She was the former Vice Chancellor of Tamilnadu Dr. MGR Medical University, former Director of Medical Education, Government of Tamil Nadu through 2013 to 2015, and has been the Dean of multiple esteemed medical colleges in Tamil Nadu, including Stanley Medical College in 2014, Kilpauk Medical College in 2011, Tirunamalai Medical College in 2010, and the Vice Principal of Madras Medical College from 2005 to 10. She has won many honorable awards and has established her presence as an eminent person in the medical field. I humbly request Dr. S. Geeta Lakshmi ma'am to deliver your speech upon the topic, replacing conventional subjective final year exams to objective pattern. Challenges ahead. Over to you, ma'am.
Ma'am, you're muted, ma'am.
Thank you for inviting me to this IMA students forum. And I'm really happy to be with you all. And I'm always with you all, with Venkatesh and Raghunandan, all there, and my Abdul Hassan and Jailal and others who are my close friends, working together for a period, and Shiv Joshi, who was now has been climbing into this ladder of medical field, as I saw him as a student and also as Venkatesh and Raghunandan, like all, and Dr. Sampath Kumar, Dr. Kanagasabai, who are here as an expert. And of course, this national exit exam 1 and 2 has come bolt out of blue, like everybody, but we had this in our mind. But all of a sudden, like the draft coming and giving us time to think over it, and giving us suggestions to make things possible smooth is the question right now. And we would work, all of us work towards the goal which the nation, the health ministry has done. And I would say this objective learning is a very good part, and it is easy for the students to go through the examination rather than writing the essay, where you have a general knowledge about everything, but you can write something out of whatever your knowledge is. So it is easy for them to get into, though they don't have a depth of knowledge. When you have this objective structured examination into the focus, it is easy. One thing is, I would say it is easy, and it is easy for the students when they get into the depth of the knowledge, which they have to know, the must know category and the nice to know category, and may know, like they need to know. So the most of the questions would be like the 60% of it, where it is must know category, where every student would go through. But the only thing I would say is, here it is the teachers, the faculty, who have to train the students, right? The faculty has to get trained by themselves, like how to teach the students the in-depth knowledge, and also the feedback from the students has to happen in the various way in their teaching methodologies. Though we have the competency-based education training, which all the teachers have to undergo one time or other, is compulsory. But still more, since this platform of objective learning has come into play, the students require the in-depth knowledge about the must-know category, where the teachers have to teach them in depth. How to teach them is the knowledge to be gained by the teachers. So it is it comes as a multidisciplinary teaching methodology, where it is objective assessment has to be made, and this assessment is gives a feedback to promote attainment of the predefined professional competency learned by a student, and to provide the student with a chance to appreciate their learning and a longitudinal competency development in their course of learning. So what are the different modalities has to be adopted, where you have the workplace-based assessment has to be done for the assessment of the competencies for a teamwork. We have to have a group team of organizational skills and professional behavior of a student. All has to be incorporated. Maintaining a multi-source feedback on a routine performance from the experts, by the peers, and by the health professionals. All this has to be added while teaching us. So the all-in-one, I would say the teachers have to take a training program for, it has to be inculcated into the competency-based curriculum, which we have a training program, ATCOM, it has been said. So each teacher has to be trained in the multiple choice question, how to frame the multiple choice question, they have to be trained, and how to train from the first year to final year, where the the vertical integration has to be made, because as you know that this objective structured questions have an applied part of it, and skill based everything. So how to teach them is very important. So the training program has to be included in the ATCOM module of MCQ preparation, how to teach the students in depth by the must know category and nice to know category, and okay, it's fine to know, good to know. All these categories have to be trained by the teachers. So I would suggest that the teachers have to be change their attitude from the lecture mode of teaching to a peer group teaching or a mentor-mentee teaching into group teaching, and see that they apply all this knowledge to the skill-based learning, whereas at the output they know everything, whatever they have read, and have a feedback in each and every class. That is what I want. In each and every class, they have to have a feedback from the student with then white paper, what they have learned. One or two or three or four questions might be given by the teacher at the end of the class, that they will get the feedback, or one to two discussion, or a mental sums. I think so many of the old people have mental sums in the schooling, right? You remember, I do not know how many of you have undergone it. At the end of the class, they will give the mental sums. Within 1 minute, they have to finish it. So give them a 1 minute paper and ask them the feedback. So you'll know where they are. And you can, the next class, you can give the MCQs for them, 10 MCQs. That is what I always suggest, of the previous classes taken by the teacher. So the next class, they are trained for 10 MCQs. So this is what is my suggestion. So it is the teachers who have to be trained now for teaching the students in various other teaching methodologies to be used, rather than the lecture mode, which we, because of the time constraint, the NMC has given that you have to take in a lecture mode. Though there is a group discussion, small group discussion, and flip chart, everything is there. But now, so everything has to be changed now. The teaching methodology has to be changed so that the students get trained up for the MC objective structured questionnaires, which they have to go through in the next one. Exit exam one. That is what is my suggestion. And the students also would be happy to learn these kind of objective learning. Would be easy for the students to come up to know. So each medical colleges also will gear up of a uniform standard throughout the country when this is implemented. And I learned from Abdul Hassan, like there might be some of the coaching centers approaching many of the medical colleges. We had also discussion. I said, why? The teachers are there, let them learn how to train the students for the objective structured questionnaires, or objective such learning of their clinical skills. Everything the teacher has to be teach. Why should we allow the external factors to come and teach them? Might be let them learn from outside, but not inside the medical colleges. This is my suggestion. And the whole thing has to be faculty centered. That when you train the faculty, the students automatically get trained. The teaching methodology should change, and the formative assessment should be with the objective structured questions and skill-based learning in the clinical examination, which will improve the standard of students and their learning capacity as an well-defined doctor when they come out. So that is what I want. Thank you one and all for inviting me.
Thank you so much, ma'am. Thank you so much for the very informative speech. Before we move on to the next speaker, with great pleasure, I welcome Dr. Sandamil Pari, sir, State President, IMA Tamilnadu. He has been awarded with many honorable awards, including Best Doctor Award of Tamil Nadu Medical Council, Best Community Service Award from Chennai Corporation, and Aringer Anna Award from Tamil Nadu Police. He is a proactive member of Lions Club and has established his proficiency as the State President of IMA Tamil Nadu. I humbly request you, sir, to address the audience.
Welcome, Dr. Pari. Dr. Pari, please unmute. Yes.
Good evening. Good evening to all. Good evening to my friends and the faculties and the MSN and the JDN people. Thanks for the opportunity. Very good interaction. CME. I think that this is the CME with leading speakers. They are holding a very highest post in various capacities. I hope this CME will be more useful to the young medicos. I wish this program will help you to understand the NEET and the next examination. It will be more useful for your future success. Wish you all the best. Thank you very much. Thank you.
Thank you so much, sir. Before we move on to the next speaker, a small question to ma'am, Dr. S. Gita Lakshmi ma'am. Ma'am, what is your suggestion for the students who are in this fear of transition?
Yeah, because transition, we have to make a transition, but if you take a longer time, there might be some obstructions coming on each and every. The more you go in for this, I think so the students would fare well. Might be the colleges train the students for the next batch. So my suggestion is never to post anything which is new. You start doing it, you know what the pipeline, the line where there might be some gaps between, but that can be filled by the. So I think so we have to move forward and stopping anything, because this is throughout the world. This is happening. Only we are only on to the examination. But if you see throughout the wide world in the world, it is all the objective structured only and with the clinical examination. So we have to move on to the changes. Of course, still more changes have to be coming in further in next 5 years also. So we have to move forward and we have to train our students. But one thing is which year I also wanted to know, but some say it is 23 December. Some say it is 24 December. So I am not clear about whether it is 24 December or 23 December, right? And already the few students have undergone the ophthalmology and ENT postings. So people came up with saying that we have finished the postings, what to do with them. But I said that doesn't mean that let them finish the posting. Only thing, again, they have to train the students on the MCQs, again, have some classes for them for train the MCQs and also the clinical examination as per the norms which is being given by the NMC right now. So I think so it is fair enough that it is one of the easiest way for the students to get through the examination and score very well, because you know each student will know where they know. So they might work hard to know where they are. So I think so it's better to go through this and proceed forward.
Thank you. Thank you so much.
I want to know whether it is 24 or 23.
Yes, ma'am.
Sure, ma'am. We will find it out as soon as possible. We will write it and get this back from the NMC competent authority, ma'am.
Yes, ma'am. Thank you so much, ma'am, for answering my question and taking your time for this. Thank you so much. Moving on, I would like to introduce the next speaker. He is the professor and head Department of Surgery, Kanyakumari Government Medical College.
Raghunandan, still I am in the car because it is very visual. You can go for the next speaker. I will
Okay, sir.
after that. Okay.
Okay, sir. No problem, sir. Thank
Sure, sir.
you.
Due to technical difficulties, we'll be moving on to the next presenter. Coming up next, I would like to introduce the next speaker. He has got 35 years of experience in the medical field and is now a professor and head of forensic medicine department at Savitha Medical College and is president of Tamilnadu Medical Legal Society. Formerly, he was heading the Department of Forensic Medicine at SRMC for 20 years and 10 years as vice principal. He had the privilege to do the autopsy for our former Prime Minister, Shri Rajiv Gandhi. Apart from this, he had performed autopsies on several sensitive cases on the orders of High Court of Madras. He was a former president and vice president of Indian Academy of Forensic Medicine and Tamil Nadu Medical Legal Society. He was awarded fellowship by IAFM and Lifetime Achievement Award by Government of Tamil Nadu. Also distinguished as a fellowship in ICFMC. He has also a number of publications to his credit and was awarded the best paper at Las Vegas, United States, at an international conference on forensic medicine and toxicology. I would like to call upon Dr. P. Sampath Kumar sir to speak upon the topic, impact of NEXT on quality of medical legal work in Indian society, challenges ahead. Over to you, sir.
Good evening. Am I audible?
Yes, sir. Yes, sir.
Okay. I'd like to first of all thank the Indian Medical Association office bearers, especially Raghunandan, for giving me this opportunity. And my topic will be on impact of NEXT on the quality of medical legal work in the Indian scenario. So, actually, medical legal work, if you see in front of a mortuary, you will find various people, not only their relatives, friends, onlookers, sometimes even magistrate and law enforcing authorities who will be there waiting for the results and the report, instant report, for which certain sensitive cases we should have in-depth knowledge. For an ordinary MBBS student itself, that is why they can shine and then improve our subject. Now, as the topic is the need for this exam of the NEXT is that one is that to filter unqualified students and then act as the single official licentiate exam like FMGE exams, also act as an official postgraduate examination replacing the NEET examination. So as per the next draft, the advantages are one nation, one exam. But the disadvantages sometimes will be facilitation of MCQ-oriented study rather than conceptual study, diminution of the knowledge of the basic sciences, especially though they give importance to other clinical subjects. So we fear that the days where we used to read Bailey and Love and all Cunningham, Gray were in depth for an big question or a long question. Now it can be, though we study in depth, but we will have to answer MCQs mainly. So the study pattern will differ. So as the former Vice Chancellor of MGR University, Professor Geeta Lakshmi said, the faculty has to be trained and it has to be one-to-one, if not at least a small group teaching with a mentor and mentee to take lectures for a small duration and then clear their doubts and then have an MCQ test on the spot itself before we go to the next chapter. So the attitude of the faculty has to change, and the training of the faculty also has to be in such a way that instead of taking large group teachings of 150 students or 250 students, it has to be ideally reduced to maximum of 25 or maximum of 30 students, where it can be taught uniformly for a slow learner as well as a moderate learner, so that he grasps the subject in depth to answer all the MCQs and to clear his doubts, so that he will be thorough with that chapter before we move on to the next chapter. And then what is the necessity for an Indian medical graduate? In India, majority of the medical legal work is done by MBBS doctors, unlike in other countries. The treating doctor, including the junior doctors and senior residents, are responsible for all types of medical legal work in India related with the patient at the time of treatment itself, wherein in other countries it is being sometimes dealt with the Justice Department or the it is the Home Department which deals. But here a medical officer will deal with all, including the administrative work of that particular hospital. So he has to enter the AR copy, he has to have a thorough knowledge, and then issue wound certificates, drunkenness certificate, age certificate, medical leave certificate, fitness certificate, and medical legal examination for sexual offense, which is also must, including accused as well as a victim. Though the victim, it is the gynecologist who is now primarily given the task. But apart from that, the most important is the autopsy, where if they do not do it perfectly to the satisfaction of all, it goes to a second autopsy, sometimes third autopsy also. So there, and 50% of the colleges in India, where of private colleges, they do not have an autopsy facility. So the students has to be trained in an autopsy, and most importantly, this medical ethics. Medical ethics, they will have to know the rights of a patient and the duties of a doctor. And apart from toxicology, where suicidal and homicidal deaths takes place, apart from other bites such as snake bites and other things. So it is essential for the administration of justice to establish the rights of the patient and the duties of a doctor in negligence cases. So they will have to be well trained in this for the benefit of the law enforcing authority as well as the Justice Department. There are many instances that the honorable judges in various criminal courts criticize the quality of the medical legal work at present also, and the medical legal reports issued by doctors in the appropriate, in the open court itself, sometimes they comment. There are so many cases where strictures were passed by the courts against the junior resident doctors, including PGs of clinical specialties and other treating doctors, for not carrying out clinical medical legal work responsibly. FIR was filed against the treating doctors for not issuing the cause of death properly. FIR was filed against the treating doctors for not informing the important medical legal cases, including rape, to the police. Courts has also directed the medical council to take action against the treating doctors for not fulfilling their responsibility in recording dying declaration. Recently also, the Allahabad court has given strictures even to the Indian Medical Council to take action on certain individuals, where in a firing case, they had entered the route of entry and exit both in front of the chest itself. And there are many instances where, due to poor medical legal knowledge of treating doctors, result in failure to identify, preserve the crucial samples or evidences in criminal cases, which otherwise may be lost forever, which misleads the investigating agencies. However, the investigating agencies are intelligent. These materials which we have to identify with an eagle's eye what we suspect to be foul play or unnatural death, unless we give them the evidences, they will be misled to be a natural disease. This leads of vital evidences in many cases which have been criticized by the law enforcing agencies and Indian judiciary. Recently, even Madurai bench of High Court have given a lot of criticism regarding the lack of information or the lack of knowledge, especially on junior doctors. Majority of treating doctors, including junior and senior residents, have lack of knowledge about routine medical legal issues and handle them independently in day-to-day practice. This is not to criticize them, but to know that the importance of basic medical sciences. If a student is not being tested for medical legal knowledge in next exams, a student may be reluctant to study and ignorant of the latest laws relating to medical practice and the medical legal formalities like dying declaration, examination of rape victim, wound certificate. Because many a time at casualty, due to the ignorance of the law, they sometimes they refer the patients which has to be treated by them, because failure to treat in a case of, say, an acid attack or a rape victim will lead to other consequences for the disrepute to the hospital as well as to the doctor and to our profession. If an Indian medical graduate is not trained, tested adequately in medical legal work, it will be detrimental to the quality of medical legal work and the medical legal evidences. This may indirectly affect the conviction rate of criminal cases and subsequently increase the crime rate, which is not good for the country. Ignorance in forensic medicine and toxicology may lead to blunder mistakes in the manner of cases to decide whether it is homicidal, suicidal, or accidental, unless we have in-depth knowledge, because with MCQs alone, we cannot decide their depth of knowledge, as sometimes mostly it can be an ethical dilemmas wherein we will have to apply our mind. And the impact of the next exam is that incomplete and inaccurate medical legal report often slow down the court trials and lead to incorrect judgments. Sometimes the patient's relatives do not get a proper justice, and it is being dragged for a many number of years, and delayed justice also is incorrect. Identification of such mistakes and shortcomings in the report can help preventing litigations against doctor, unbiased court judgments, and injustice. So when a case is there, they will have to thoroughly investigate right from their clothing and their belongings before handing them to their relatives or to the police, because it can be destroyed by the police unknowingly or sometimes wantedly. So we will have to record, and if the delay in recording a dying declaration and if necessary a dying deposition, the fact of the circumstances of the case will be lost, and once he dies, there may not be documentary proof to document the circumstances of which led to his death. And recently there was a doctor who has been stabbed, and sometime back a gynecologist also had committed suicide. That is all because of lack of knowledge of the medical law, that they cannot, the doctor cannot be arrested unless it has been proved to be a negligent case, and wantedly the negligence has been done wantedly, and not following the patient's attitude and being concerned to the patient and not being able to communicate properly to the patient. These are all clinical skills which not only to teach, but how it can be assessed with just MCQs alone is my doubt. India being a country which is heavily populous and with most of the population still residing in the rural and less accessible regions, the healthcare system is designed in such a way that MBBS doctors are posted to take care of the entire village or region, and sometimes even the administration. In such situations, the doctors completing MBBS are mandatory to perform autopsies, and they need to provide with adequate skills and they need to be tested on the same to provide standardization in the quality. So the esteemed National Medical Commission has very rightly identified the need for the independence to be posted in the Department of Forensic Medicine and Toxicology, and the special competencies to be acquired by the interns during CRMI posting. So they have rightly pointed out and given us the due importance, but it should not be reduced by giving 10% of the marks in basic medical sciences. However, with the current release regulations for next, I feel certain changes would go a long way in helping the MBBS graduates to be fully functioning as an independent doctor with competency and ability to safeguard them and have a good practice and also provide optimal care to the patients at last. So what needs to be done? So the competencies relating to the medico-legal knowledge needs to be tested for a qualifying doctor who is going to be dealing with the medico-legal case in a day-to-day practice. Accordingly, representation of the forensic medicine and toxicology needs to be increased and also evaluated properly. The representation in clinical forensic medicine can be increased by evaluating of awareness, knowledge of medico-legal cases and protocols to be followed. The medical student completing internship and appearing for next two need to have separate paper on medical ethics, and the prevailing jurisdiction or justification in India or jurisprudence also to make them competent and also up to the international standards. So they should have knowledge of the physician-patient relationship, and so that they will be careful to avoid negligence. A medical graduate from foreign universities undergoing training in other countries and hence have very little exposure on the medico-legal practice and implications in India. This is a huge factor of concern, and I feel we have to we have very big responsibility in making them aware and understand our local mechanisms, even as simple as the protocols to be followed for informing the authorities of sexual assault, suicide, etc. For example, though a foreign graduate who comes here and finishes the exam, it will be very difficult for him to communicate, leave alone the language, but to communicate with the police also it needs a talent. So how you inform a medical legal case to the police, how you make him explaining the importance and make him to arrive at the spot immediately so that he can proceed with the dying declaration, or the doctor itself should be capable of taking a proper dying declaration or even a proper informed consent, so that the patient is explained properly in the languages he knows, and so that there is no litigation later on. Even getting the consent of a witness now has changed from the patient's relatives or the hospital workers to a co-patient or a third uninterested patient. I would also like to bring to your notice that other standardized international examinations like USMLE or MRCP have very clear emphasis on medical ethics in their exams, and the students are tested in the same with great importance. Hence, we also should have such a mechanism to test. I really believe that in producing qualified doctors in a country such as India, medical ethics as well as clinical forensic medicine needs to be deeply imbibed in them, frequent questioning and reiterating the importance at every level to produce doctors in the country to be proud of. So this is my humble suggestion that more importance has to be given for basic medical sciences, and also there should be a mechanism that they have learned and it has their clinical skills has to be tested. If they pass the part 1 and part 2 is left to the individual colleges. So whether they will have that interest to give them a full training, or the student, once they finish the part 1, they enter the house agency, they will be interested to take to the part 1 exam again, so that they can improve, and they may not concentrate much on the training of the house agency, which is more important, as all the speakers and other office bearers know that they can take a second exam or even the third exam, and they'll be concentrating on the improving their part 1 exam of the next itself, than to do an efficient or proficient training in their internship. This is my humble suggestion, and I leave it to the learned office bearers to sum up and then to recommend to the Indian Medical Association.
Yeah. Yeah,
Thank you very much.
Yeah, really, Sampath Kumar, you have done well, but I want a little bit of suggestions here.
Yes, ma'am.
Our changing teaching pattern, I have already said that it has to be changed. So integration of forensic in surgery or in the emergency medicine, it has to be integrated. So only we have to change the students. So we have to change first and then teach the students. So this would have an integration of all the subjects from first year to which would be from the basic medical science to the other one. The second one, which you said, they'd be doing the house surgeons, internship, they would go for the learning pattern of the MCQs, but it's not the NMC has so said that for the next 1 year, they cannot write the exit exam 1. They have to for the next 1 year only, the next year only they have to write, not on the same year. Okay, so they have an ample of time, so that doesn't matter. They have to pass the clinical examination from a same university. So clinical exam, we have the control on the students, and they have to go through the entire internships rigorously, so that they pass the clinical examination in the university. They had undergone the training. So they are under the control of the university, and because of that, they would undergo the training during their internship. That is what is my idea. So I think so we would we have to train ourselves for the training of the students.
Correct, madam. Correct, madam. I agree fully with you, but that has to be done from the first year itself, and then this can be implemented.
Yes, yes, that's what we have to change. Change is with the faculty. Then we have to change everything.
Faculty.
Thank you, thank you.
Thank you, ma'am. Thank you, ma'am.
Thank you, sir. Thank you very much for the very interesting speech. I would also like to thank Dr. Magendran, sir, National Faculty for PG Entrance Exam, for bringing us notice of this issue and helped us with organizing this topic with Dr. Sampath Kumar. Moving on to the next speaker, I would like to introduce our next speaker. He is the former Vice Chancellor of Bharat University and former Director of Medical Education, Government of Tamilnadu. He has been Dean of Madras Medical College for 3 years, Dean of multiple meritorious medical colleges like Kilpauk Medical College, Salem Medical College, Dharmapuri Medical College, and was Director of Medical Education for 1 year and Vice Chancellor for 5 years. He has many meritorious awards and has been an eminent person in the field. I now welcome Dr. V. Kanagasabai, sir, to deliver his knowledge upon the topic, accessing the skills post-internship, a broader perspective. Over to you, sir.
Yeah, thank you, doctor. Am I audible? Am I audible, please?
Yes, sir.
Yes, okay. Fine, thank you. Dear Dr. Abul Hassan, Dr. Jayalal, Dr. Sendamil Pari, Professor Geeta Lakshmi, Dr. Raghunandan, Dr. Surya, Dr. Shiv Joshi, Dr. Venkatesh, other guest speakers, my colleagues, and my young colleagues who are aspiring for completing their MBBS course and going to their postgraduate course. As all of you are aware, the NMC has put on a public notice on 28th December asking for clarification. That itself is a great move, because from the NMC, they are asking our opinion, the public opinion regarding any corrections or any modifications required. So this is the first move by the Government of India. So we should appreciate that they are asking our opinion. Next is, I appreciate the Indian Medical Association student wing who have taken up this topic to discuss threadbare to find the problems and solutions for those problems. So I thank the organizers for inviting me for this discussion. Coming to the topic, today's topic. See, first thing I like to take is about on the page number 8 of the public notice. They have given different hours for various subjects like medicine and allied specialties. They are given 120 hours, 120 questions, and for surgery it is 120 items, OG 120 items, pediatrics 60 items. For ENT they are given 60, ophthalmology 60. But unfortunately, what is health? Health is not mere absence of disease, but a sense of well-being, physical well-being, mental well-being, social well-being, and spiritual well-being. Unfortunately, we have not given importance to mental well-being itself. And as all of you are aware, stress component, that too post-COVID, entire world, it has increased. And number of anxiety and depressed cases has increased. And India, we are usually a tense population. There is people are tense, and there is number of anxiety, depression, and other diseases. So right from beginning, importance is not given to mental treatment or psychological treatment. So in this subjects, various subjects, I would have been happy if they are given more importance to psychiatry, because every individual has stress. Every individual goes through, see, the disease pattern, see, BP or diabetes, 10-15% only. Any disease, it is only 10-15% occurrence. Even obesity, 30% only. But stress and anxiety, they contribute more than 30%. Every individual goes through stress in various parts of his life. So emotional importance is not given in the curriculum. Other thing is palliative care medicine. A new concept has come, palliative care medicine, which has to be integrated with all curative treatment, any long-standing diseases like diabetes, hypertension, cancer, joint pains, obesity. There should be a palliative care treatment which has to run simultaneously with the therapeutic treatment. And this palliative care treatment goes beyond after the death also. It goes to grief counseling. So this a new specialty is palliative care medicine, where India is lagging way behind compared to other specialties. So importance is not given. This occurs, this column is seen in the page number 8. Then second point, what I want to stress is about the type of questions. They are given problem solving, analytical 65%, comprehensive type 25%, recall type up to 10%. And all our teachers and students are used to recall type. And as Professor Geeta Lakshmi has rightly pointed out, so we have to put the bullock before the cart. So all the teachers throughout the country has to be trained in how to set up a multiple choice question for the entire syllabus. The two, they have to integrate between basic sciences and clinical sciences. So this teachers has to be trained. See, when UGC started a program way back in 1970s, they had a faculty improvement program for arts and science colleges. They had a faculty improvement program, and the teachers were sent for higher training. Even in schools, teachers handling 6th, 7th, 8th standard, after studying BA or BSc, they undergo a 2-year educational training and they get the B.Ed certificate. Then only they become qualified teachers. Teaching is a separate profession. Unfortunately, in medical curriculum, we do our post-graduation. Next day, we become PG teachers. The 1-year junior becomes a student to us, and we become PG teachers. So we are not trained in teachers. And nowadays, children are very intelligent. So for teaching them, our teachers has to be trained, and the teachers has to be trained in problem solving, analytical skills, comprehensive type. All the teachers throughout the country, about the 650 medical college, the teacher training has to be completed. Then only this program can be implemented in the colleges. And so more so, our colleges, India is a diverse country with a lot of major cities where people are more used to these type of exercises. There are muscle centers where again teaching skills will be less. So entire teaching skill has to be enhanced initially. This is seen in page 7 of the document. Coming to the third thing is MCQs. They ask about all the questions are multiple choice questions. I'm not going to the details because already doctors don't have the habit of writing case sheets. They don't write, they put signatures. When once MCQs comes, the subjective writing for the answers will go off and they cannot write. So all the answers will become objective. They just tick. And they are not mentioned whether there is negative marks. See, once it is MCQ, you should have some negative marks. Otherwise, simply ticking the paper, everybody can pass or get some marks. So MCQs, they didn't mention about any negative marks. And they are insisting on 50% pass mark. Those days when we were students, when Professor Geeta Lakshmi, me and all were students, 80 to 90% of the mark has to be obtained to get into a medical college. 90% is required to get into medical college. The pass percentage was 50%. Professor Sampath Kumar will so agree. You get input is 90%, output passing is 50%. Now it is totally reversed. Input, I don't know how much of what is the input. NEET scores are very low marks input, or they can get MBBS scores. But they are asking 50% pass in all the 6 papers. So that will be tough for the students. We have to filter at the entry point. If you don't filter at the entry point, if you admit students with less marks with MBBS scores, they can't come out outside with 50 marks. That seems incomparable. And the next point, what I want to improve is next exam step 1, that marks will be counted only for 3 years. So in 3 years, if he's not able to get a PG seat, he has to again appear for next step 1, which can be avoided. Because one time he has got a mark, that mark can be utilized whenever he wants. If he wants to improve, let him go for improvement. That is permissible here. But again, improvement also on the page 6 of the document, they are given the improvement average will be taken. I don't know why they take the average. Once a person is allowed to take an improvement, the higher score should be taken for considering it. They should not take an average. Again, regarding one question, somebody, Raghunandan was asking, I suppose, to Professor Geeta Lakshmi, what happens to the present students who are undergoing through this curriculum and suddenly you put next exam comes in. On the page 3 itself of the document, they have given the use of scores and normalization of different examination, and the next exam shall be determined by the agency. So they will appropriate time, they will have normalization. So if you get NEET mark this much, this is equivalent to this mark in the next exam. That government will come out with a proposal. They have mentioned the page 3. But regarding the implementation, yes, as our previous speakers told, whether it is 23 will not be possible because already we are in 23. So the government has to give enough notice for the teachers, for the students, for the universities to conduct. So in my opinion, a government will not be in such a haste to conduct in 23, maybe in 24, but that also we require training. And regarding ATCOM, that attitude, ethics, and communication has been introduced in the MBBS curriculum by the NMC from 2019. Even palliative care has been introduced from 2019. But our teachers who teach this subject of attitude, ethics, and communication, they are not trained. First, the teachers has to be trained. Without training, if you don't learn and you train, that is quackery. So the teachers has to be trained in attitude, as teachers has to be trained in ethics, and teachers has to be trained in communication. I also agree Professor Sampath Kumar's version on the medico-legal cases, doctors' awareness about medico-legal cases and the cause of death. They have to certify death certificate has to be signed by doctors, so that they should have knowledge regarding rape. He has expressed his apprehension regarding wound certificate. These are all vital areas, as Professor Sampath Kumar told about wound certificate, rape, cause of death, the medico-legal cases. The students should be exposed to a legal medicine in a more liberal manner. This 10% for all the basic sciences of 6 subjects will not be sufficient. 7 subjects will not be adequate. And community medicine also, they have put 10% only. And we have to go, prevention is better than cure. We say always, in Tamil also we say, Varumun Kappom. Varumun Kappom, community medicine department, only 10% is given importance regarding vaccination and those things, diet, nutrition, exercise, because being non-communicable diseases, which can be prevented by lifestyle changes. So when such is, now we are going through a heavy load of non-communicable diseases where lifestyle changes has to be done. So there, your 10% is only community medicine being a play, which is not adequate. So similarly, the doctors in cities and medical colleges in cities, they can fare easily, but in rural setup, it will be very difficult, both for the student as well as for the teachers. Anyway, with these few points, I'd like to thank the organizers for inviting me this. These are my humble suggestions. Thank you very much. I am ready to answer your questions from the students or from the speakers who have organized. Thank you.
Thank you, sir. Just one doubt from my side.
Yes,
Since in the next guidelines they have given, they have mentioned that for the next two specifically, it will be conducted by university and it will be used case-based stimulators, etc. will be used for accessing the skills. Will it be like again uniformity will be a questionable first thing.
No, that is, you can't bring it. You can't bring uniformity, can't be brought. That is not feasible, doctor. Government can't do anything. It can go up to certain level only.
Yes, sir. That is the first thing. And second thing is like whether every college will be like having so much facility for a stimulator based accessing the student skill.
Yes. That's because the NMC has given a guidelines for a skill lab to be instituted in all colleges. Skill labs. So skill lab training has become a must. So similar training will be there. But what I understand from your clinical examination, your question is, according to the guidelines, the public notice says the state university will conduct the exam. We don't know whether the deemed university will be permitted to conduct the exam or the state university. Suppose in Tamilnadu, there is a number of 6-7 deemed universities are there. They conduct their own exams for MBBS. But whether we don't know whether the MGR Medical University of the state medical university, Dr. Tamilnadu MGR University will conduct or the deemed university will conduct, they are not given clarification. But whoever conducts, because throughout India, 650 medical colleges, the clinical exam cannot be conducted on a uniform basis. They are giving much importance to the step 1 only. Steps 2, as previous speakers also told, it will become a routine. It can't be given much importance. Importance is given only to step 1, where MCQs are asked for different subjects.
Thank you, sir.
Thank you, sir. If there are any other questions from the dignitaries, please, I request the dignitaries to discuss them right now to sir.
Yes,
Yes, sir. Yes, sir.
Just like Dr. Kanagasabai said, if they pass step 1, it is all automatically taken that they will pass step 2 itself, as there will not be uniformity. That is one. And secondly, AIIMS and other institutions, PSG, Chandigarh, they do not come under this preview.
Okay, sir. Surya, we can proceed to next speaker.
Yes, sir. Okay, so up next, I would like to introduce our next speaker. He is a consultant at Department of Internal Medicine at various hospitals, including Gleneagles Global Health City, Sudhar Hospital, and H2 Hospitals, and Managing Director at Dr. Ran's Medicare Private Limited. He has conducted various workshops and presentations and is the recipient of Doctor's Day Award in IMA 2021. He is a faculty at Pass the Paces MRCP training and is also a treasurer of IMA Tamil. I gladly welcome Dr. V.S. Hariharan sir to speak upon the topic, is it a path towards standardization with international licensing exams? Over to you, sir.
Am I audible, Raghu?
Yes, sir. Yes, sir.
Yeah. Good evening, all, and thanks for the opportunity to Dr. Abul Hassan and Dr. Raghu and all others who are in the organizing team. Yeah, I think we have heard a lot from very experienced vice chancellors, leaders of IMA, professors. I think I'm a little different, that I'm a clinician, but into something that I do regularly, that is to teach people to pass MRCP exam. So this is one of those standard exams that happened throughout the world, and it is recognized. Although this is not a licensing exam, but then it has its all similarity to what is next. So over the next 10 minutes, I will take you through why this exam is there, and what is positive and what is negative. So most of the times the regulations and licensing exams of doctor happens because of economic pressures, political pressures, the geography and the demographic factors that affect. And as the countries develop, over the last 20 years, we have had multiple legislations coming into this medical profession, from your CEA coming, then you have your Consumer Protection Act coming. We have regulations for how a medical college should be run. The MCA became an NMC, and so many other regulations have been changing. This is just to increase the demands of accountability and assurance to the public and increase the trust in the public. So that's why we are facing large scale examinations here. And other plus point of this whole thing is, if a standard is risen to the international level, so there are people who go across for medical training, there are people who move across to work in other countries. So it will help them plan exams, and if it is recognized elsewhere, things will make it easy. So the basic requirement for a license exam would be to maintain minimum standards. It should be a straightforward exam and should have a transparent route. So this is how people plan licensing exam all through the world. And when there's a licensing exam with certain standard, it is reassuring to the public that there's a certain safety level that is maintained in the doctor's company. So you may not have the best levels. It is a certain minimum standard that is maintained throughout, so that all the people practice a certain minimal standard. And these exams should assess the basic medical science knowledge and the clinical knowledge, assess clinical skills, and it also should help assess patients' management skills. So all the Western exams assess the skills of managing patients as well. So currently, you all know, we go to various medical college. After clearing the NEET, we go to various medical university, 4.5 years of training, and then we have a final exam. And after, when you clear the final exam, you get a temporary registration certificate. And when you complete the 1 year of CRRI, you get your permanent registration certificate. So, but the training in each medical college is varied. The standards that are established in each medical college is varied. So people who study abroad come here, do the FMGE exam, and then get through the process. It's a difficult exam because I think they are not used to our methodology of teaching, and they go through this. So the Medical Degrees Act that was started in 1916, so it is gone through, and the last act is come as an NMC Act that is now currently in place. So the proposed next has 2 steps, as everyone has been speaking. So the first step has 6 papers, mostly MCQ based learning there, with from medicine, surgery, OG, pediatrics, ENT, ophthal, and a part of the applied part from the other subjects that come into here. It's going to be a computer based test according to the document that is given there, and it is going to be run by a commission or a authority or a body that is going to be recognized by the NMC. The second part is going to be practical clinical viva voce, and it's going to be again in medicine, surgery, OG, pediatrics, and ENT, ophthal, and orthopedics. And it is going to be run by the state university or the institutions, and they are going to give some certain guidelines regarding how to run this. So the first part is going to be an MCQ based, computer based thing, and the second part is going to be practical face-to-face exam that has to go through this. What is the purpose of having next is it's going to be a single exam for multiple purposes. So instead of your final year exam, you go through next. For an eligibility for your provisional registration, you go through next. To get a license to practice after you have completed your MBBS, you have to have the next cleared. So, and then you have your admissions to your broad specialties, that's your PG, instead of your NEETPG, it's going to be next. And there's a small line that is added as well. It's going to be, these scores could be used for employment, scholarships, and fellowships as deemed by the National Medical Council. So I think I had noted this down. So it's going to be one exam that's going to serve multiple purposes, and the most similar exam that is held internationally is the United States examination, the USMLE. So in US, after people go through the schooling, they have to enter the medical school prerequisite. So there's an undergraduation course for 4 years where they are supposed to take basic subjects that are needed for qualification for the MCAT, and after going through that, they enter the medical school. And the first 2 years in the US are usually general medical education, that is classroom based, where they teach you the basic sciences part. And towards the end of 2 years, people go through the USMLE for the first 2 years. And in the third year, the clinical test, the step 2 starts. And people clear that, and then by the time they finish 4th year, where they have specialty electives, they go into residency. So the step 2 is where you determine yourself to go into which kind of this thing. And after you go through your residency, you have a board exam. That's also a computer based exam. And there are a few people who go into fellowship. So this is the most similar exam that has been happening. This is a computer based exam, that is 3-part exam. So the step 1 here basically tests the basic parts of medicine. That's your anatomy, physiology, your statistics, your biochemistry, all those basic principles being tested in the first part. The second part is to know medical knowledge, skills, understanding the clinical sense. So there are clinical scenarios that are there. Then you have your medicine OG part getting there, and then there's a practical. So there's an MCQ based this thing. The clinical part is happening. The step 3 is where you have and the step 2 is needed for understanding, for supervised. So someone who's cleared step 2 is eligible for a supervised care. So that is like your CRRI. CRRI is where we have supervised care. So step 3 is where you are again tested, and once you clear this, you are eligible for an unsupervised medical practice. So this has been there in US since 1992, and it's going on through a evaluation phase, and almost like 1 lakh students graduate through this every year. So this is the most similar exam. But these kind of exams were in the first probably country to go start this kind of exam was Canada. It was in 1912 where the Medical Council of Canada decided that they have this kind of exam, where currently it's a computer-based 4-hour exam where 210 questions, multiple choices there. Then they have a 3.5 hours, 38 case clinical decision-making exam. This is part 1. And the part 2 is an OSCE exam where they have 10 cases and then you are examined. But over the last few years, people feel this examination is getting obsolete and they are trying to change this. So this is one of the oldest exams. India has most of its origin from the United Kingdom, but currently United Kingdom, for people who studied in United Kingdom, there's no licensing exam. Although they go through a 4-year medical school, then they have something called a foundation year 1 and 2. This is where it's like a house agency. Then they run through specialist training or a GP training, and some people go into core training. So depending on that, after your foundation, they get into specialist training and then they become consultants. People from outside go through something called PLAB, and this has part 1 and part 2. Part 1 is 180 single best answer questions that people go through. And part 2 is where you have your OSCEs. There are 16 stations and they're all time-bound exams where even your practical exam, it is 8 + 2 minutes and you have to finish 16 stations. And once you clear PLAB, that is when people are trained outside, they enter a level in the what we call our CRRI, and there they call their foundation years around F1 and F2. So this is where they enter and then they go from there. So United Kingdom is also now contemplating on a medical licensing exam for all students. That is, people who are doing their medical schooling in UK, whether they do it in certain European Union countries, they are allowed to go and work in the UK without going through the PLAB. but now it's going to be all international students. Everyone have to go through the UK, and it's going to be consisting of two parts. One is applied knowledge test and then a clinical professional skill assessment. So one is a computer based MCQ test and the other one is where they are going to have this. My interaction with, my training of most people go into where we train people to get into MRCP exam. So MRCP is Member of Royal College of Physicians. So this is not a qualifying exam, but this exam was initially intended to get junior doctors work in the hierarchy in the UK, where you can get good competent doctors who are not liability and they have safe practice. So the exam consists of two parts. The part one, where you have MCQ based for the basic sciences questions, and those MCQs are, they include very few questions that involve recall, and most of it is applied anatomy, applied physiology, applied pathology, all those things that happen, and they try to give clinical scenarios, and then you have to answer two MCQ parts. And then when you go to part two, you have two papers. Part one is an MCQ, 3 paper MCQ based questioning, where it is more clinical oriented, where you have importance even to statistics, medical law, psychiatry, everything into the MCQ based questions where you have clinical scenario. And then you have a part B where it is spaces. So it's the practical. They have a 5-station exam where you have a time bound examination, 6 minutes for your clinical examination. Then there are stations where you have to take history in front of 2 examiners, where you have to go through a methodology, and the conduct of the doctor is taken care, the patient welfare is being marked, and then there are communication scenarios where you have to break bad news, where you have to handle difficult patients, then where you have to handle where scenarios where there could have been a medical negligence. So all those things, the ethical part, the law part, clinical sciences, and your day-to-day practice becomes a part of the PACES exam. This is a very, it is one of the fair exams that people can go through, because the bias is very little, and it is quite structured. So even the clinical cases that they have kept for the PACES are calibrated, and they keep cases that are up to the stage where they don't keep things that are very difficult. So advantage of having a single exit exam is there's going to be a single exam for final year, joining college, licensing. So you don't have to keep reading again and again for an exam, trying to read for one exam, clearing it, concentrating on what you want to do, go ahead. This will definitely maintain minimum standards, provided it is conducted in the way it is thought forward. We will have a reliable and transparent, valid measure of passing the exam. So if someone has to go through this, and the knowledge is tested in various capacities where the recall and all other parts have been this thing, I think it would be a this thing. And it gives a quality assurance for the medical college. So if people from medical college or a university are trained to do this, the quality of the university. So the initial part why Canada came to this exit exam was they wanted to improve the quality of their medical colleges, and they have done so. So this thing. So this will address certain negatives in the current system. The challenges. So when there's standardization, people will forget to innovate. So their idea of just learning the basic minimum required to pass would be there. Teaching would become more exam oriented than having people have a long discussion. In depth may not be there certain times where we would like having our structure here. the large number of candidates that are going to get out of medical colleges would pose a challenge to maintain. I think the MCQ computer-based part would hold true, but when it comes to huge number of universities, medical colleges, maintaining the standard in the part, the step 2 of the next exam would be a huge challenge, as I see, because the teachers and everyone have to learn to standardize their cases and the way they approach the exam. So it would be a big learning curve for the teachers as well. And then this may give a bias to certain medical college. So if someone joins a certain medical college, they are trained to clear next, those colleges may get a certain stratification. So all these colleges are good colleges to pass next, and these colleges may not be the best colleges to pass next. So there would be some stratifications that would come. And this is going to be only a one-time assessment. It's not going to be ongoing assessment. So I mean, how a medical student should be tested is ongoing assessment throughout his career, and not probably a one-time test that could do this. So this could be one negative there. So the step 2 standardization I have talked about, and certain clinical skills like, okay, I think we can ask questions about writing down a certificate. We could ask when someone could certify death or something. But when it comes to actually writing down a death certificate, or when someone can check whether someone can do a basic suturing or put a basic vent plan, maybe these tests have to be improvised, and maybe we have to do a lot more. And to set up this exam, it is going to take a lot of time, maybe 1.5 years would be a very short time. There would be a lot of money, there would be a lot of resources that have to be spent, because when people set an MCQ for the USMLE, the average time taken for an MCQ to go through the process is almost like 50 hours of constantly changing. So one MCQ takes 50 hours in a USMLE test. So it is, but I mean, after seeing COVID has taught us a lot of lessons. So, I mean, it was a new disease. All of us were, stunned by it first, then we reacted. I think India reacted the most appropriate way, because we, I think, have fared better than most of other countries. So we can take in challenges, and would probably take in more challenges and cause an international standard. But the major difficulty that we would go through is when something becomes computer based, it is going to be, if there are 4 answers, there would be only one right answer. For example, for treating COVID, I think each institute, each university, each hospital had its own kind of protocol that went through, and they didn't have this thing. And each association, so the IDA association gave one recommendation, the ICMR gave a recommendation. So there was lots of conflict. So India has to come up with a protocol based treating for before we have such large amount of exam that is going to become computerized, and it is going to this. So so summing up, next is a welcome step, because it's going to maintain basic minimum standard. It will reduce the number of examination people go through. Currently, there are very few internationally accepted exams currently, and if next, if the next is created in a way, it would become one of those few internationally accepted exams. So, but it will take a long time to metamorphose into one of those best exams that people can go through. Thank you for the opportunity. If there are any questions, I will take it. Thank you.
Thank you so much, sir, for the affirmative and thought-provoking speech. If there are any questions from our dignitaries, I request our dignitaries to discuss them now to our speaker. Assuming there are no questions, I would be moving on to the next speaker. He is the professor and head Department of Surgery, Kanyakumari Government Medical College. He was Professor, Department of Surgery, Tirunelveli Medical College, and the past National President of IMA Headquarters 2021-2022. After doing his UG and MS, Sir went to Canada to pursue his MBA and DLS in Germany. He has published a book, several articles, and was the editorial board and is a member in 5 international journals. He received the Best Doctor Award from Kanyakumari District Collector and Government of Tamilnadu, Best Teacher Award from TNMGR University and National IMA. I humbly call upon Dr. J.A. Jayalal sir to speak upon the topic. Next one, postgraduate admissions, hurdles ahead. Over to you, sir.
Thank you. I'm sorry that I couldn't be, though I was with you, but I couldn't speak in the earlier. But I'm so happy that MSN could organize this meeting. I could hear the speeches of various speakers, and all of you has covered very important challenges which you are going to face with the next. I could also hear from Dr. Harigaran the comparative study with the next and the international exams, and it's good in a way. This is a fear which we were always having, that when the next was introduced, that Indian Medical Association per se, that we were opposing this, because this is a one step which is going to impart a very, very difficult situation for the postgraduate entry into the postgraduation for the students, because India is a multidisciplinary, multicultural diversity, and from the urban to rural, a lot of difference is there in the different medical colleges. Though we have nearly 1 lakh students are appearing, invariably the amount of training, the amount of way in which they are getting the experience are different. But for all of them, making one examination to grade them, pass them, and making them to eligibility to entrance, also in the same way, it is going to be a big challenge and big difficulty. But nevertheless, because now it has been introduced and it has to come, and the students has to take extraordinary steps and extraordinary care, both the faculty also, to make sure that you are able to ease out the problem. So a few challenges we have, because now it is now in the public domain, and so that we are expected to give our report, and the Indian Medical Association is also collecting data and giving our report. One of the most important thing, the first thing is what we note, there is no clarity on that who is going to conduct this examination. And this is a big dilemma, and because so far there's various exams are conducted by the national board. Now, NMC is not interested to hand over this examination conducting authority to the national board, and they are now trying to establish their own body, or they are trying to give to some of the institutions like AIIMS. So when people of the caliber of the AIIMS or something is going to take the examination, that exam pattern is going to be very tough, very difficult for an average doctor to face. So that is a big challenge now we are having, that who is going to conduct the examination unless it is being streamlined, and we will not be able to do. And when this examination, who will be subject to the examination is still becoming a difficulty, because we are not sure whether it is going to be applied for the 2018 or the 2019 or 2020 batch. But Indian Medical Association, now what we are recommending that it shall be possible only after 2021 batch, because when the 2021 batch students are joining, the curriculum was set and the pattern was given, the way in which the examination schedule with the final exam in combination with the part 1, part 2. So all that has been set. So they are focused. So when you are joining, when you are not sure that how your examination pattern, you cannot have that. So this is our demand, that at least this next shall not be applicable to 2018, 19 and 20 batch. I'm sure that it cannot be for the 2018 batch, because they are now about to write the examination in the February. So they will not be able to do that. And the government has given a opportunity in the act itself, that they say if the phasing out of NEET, it is not an abrupt stopping of the NEET, it is only a phasing out. The government can have a plan to have the NEET as long as it is going to be has a value. So this class of the act that MSN and the JDN and the IMA should use very strongly to see to that it should be applied to the people who are entering at least by the 2021 batch, and where the syllabus is there. The third, that's one of the dangerous class which has been incorporated, is this exam is not only for the BBS students of India and the students who are coming from abroad. A class is being included whatever the degree which the government feel can be incorporated into the medical section, they will be also allowed to write this examination. So that is a quite dangerous thing, which is it is in a in reading it along with the National Health Education Policy or the government policy of the mixopathy, in the future, the government may try to introduce and incorporate this into next one or next two can be incorporated to make sure that Ayush people are also now getting to come into the system. So that is again going to be a big challenge that we need to be extremely cautious on that and fight out this. One of the big challenge what I feel is the exam pattern of the NEET next 1 and 2, which they say the supplementary exam and the next exam will be after a year. So by chance, you get into some sickness of take a leave of 2 months or leave of 3 months, or if you are getting into a problem, you met with an accident and you having a fractured your leg or fractured your hand, you may not be able to come for the college for the 2 months. Then your opportunity for sitting in the examination is going to come only after a year. That means you are going to lose almost 9 to 8 months unnecessarily just because that when they are saying that this examination, when Hariharan was saying that this examination is at par with the USMLE. USMLE is not conducted once in a year. It is conducted even normally, basically 2 times or 3 times they are able to conduct the examination. So unless this examination pattern, when they are going to give the gap of 1 year, that is going to be a big challenge. Similarly, it is for the next 2 also. Even the house urgency, when you are doing, there is a now the system is there. A student, before he finishes the internship, he can go abroad, have a training for 3 months, 4 months, or observership, come back, and he can finish the examination, finish the internship. But it is not possible now, because you are going to take 2 months leave, then you are going to sit for another 1 year to face your next 2 examinations. So this class is a very dangerous class unless that you are going to make the examination periodically at minimum once in 6 months or minimum once in 3-4 months. If we are at least the part 2 examination, if it is not going to help, this is going to hamper many students, and many students will be face a problem, because then it also has the private medical colleges can play on that, because now there's some certain private medical colleges are very strict on the attendance, and they are going to charge exorbitantly for clearing the attendance. I know that some of the universities are also playing a role. If you have a 10% attendance lack, then you have to pay so much of money to clear that. So similarly, if you are going to have the examination for the waiting for another 8 months or 9 months, and then naturally it is a very difficult center. The another issue which we find it difficulty is that is next 1 and 2 is going to be conducted in a center where the government feel it is appropriate. So it is not going to be happen in your college. It is not going to happen in an institution. Maybe it is going to happen in another place, and how that place is going to be chosen, how that place is going to be operated, when you are going to be in a different situation, how it is going to be impact. This also again becoming a big problem. It is going to happen. Most importantly, what I feel that is one of the going to be the worriest problem for me. The government, they say that they are going to make the examinations. The questions are going to be the basic questions. That's the must-know questions 60%, and the rest from the 20% extra, and the nice to know, and what you are going to do. But who is going to decide which is the need to know? So far, it is institution-based or the university-based. Within a university can decide which is the need for. For example, if you take hernia, and if I take on, if you know only the anatomy and the surgery by name, that is a must know. And if you try to know lab surgery is as a need to know or nice to know. But that same is not true with an AIIMS. It is not true with an higher institution. It is not same with Madras Medical College and Kanyakumari Medical College, where the faculty thinks are the one university things as a must know may not be the true for the must know for another university in abroad. And I have seen certain universities of the private universities, they are even giving the questions earlier and say this is kind of question we are going to take, and this will be the need to know and must know, and that classification clarity, who is going to decide? Is it is going to be the NMC is going to come out with that this is the must know chapters, these are the need to know or nice to know chapters, and that clarity is not there. It is being decided by the universities. Now when it is going to be taken in an all India panel and going to impress upon the rural student, impress upon the students who are going come from the a college which is not having updated, this is going to impact the students from getting into the major issue of facing that. What you may think that it is not a must know, the examiner or the person who is going to set may think that it is a must know, and he may ask the question. So that clarity of that examination pattern is not going to be there. And more so, that many speakers has already explained about the problem we are going to face with an MCQ, the problems which we are going to face with it. Nowhere, even if the USMLE or any examination you say, it is not going to be depend only upon an MCQ. No one can get an admission in a PG institution after your the two months of the fundamental course in the UK or US. You cannot get into the PG just because you score high marks in an MCQ based question. So there are so many other factors playing, but unfortunately in India, so it is purely on your MCQ question. It is not going to be any other factor and any other way that you have contributed is not going to be of that, especially whether you have done a research, whether you are done involved in any publication, when you are involved in any of the extraordinary skill work which you have done, all that is not going to count it. So it is going to be a mere your examination pattern MCQ. So in no way that it can be connected with any other international examination where it is purely based on the MCQ. So still it is going to make you much difficult to get into the admission into the postgraduate stream. The most crucial issue comes that you are passing and someone is saying that you are eligible to get into the postgraduate examination. And unfortunately, if you get into your university, you have a problem with your own HOD, you have a problem with your own person. And if that college is thinking that I will not make him to pass the university examination, and then what is the fate of you? Even if you are one person is going to score highest mark and making it eligible to get into the PG, and if he is not able to pass the university examination, which is going to be conducted separately, exclusively in the college with the old pattern of the examination pattern, and then it is going to be a disaster for the student. We can the dichotomy, the personal ego, the personal egotic class, and the various ifs and buts which is placing in that examinations are going to be of a big challenge for the students to face. So how he is going to concentrate for the practical exam and theory exam in a totally a different setup, and how he is going to get into this is a big problem. And the certification, who is going to give a certificate, is not being explained by that. Under as per the UGC Act, it has to be only the university has to write to give the degree certificate. But now here, someone is writing your theory examination, conducting the theory examination. It is not yet decided. So somebody will be conducting theory examination, taking that as a pass mark for the theory. Now university has to give a certificate, give a pass degree certificate. But that is quite unfair for a university, because the only purpose of the university is to screen you and take into your consideration. So that is going to be again a big defect unless this act is going to modify the UGC Act, modify the Degree Act of India, and it is again going to make a big problem, and it is again the students are going to face a major issues of that. And many teachers, including Gita Lakshmi, was telling that the faculty has to be trained, faculty has to be done. Yes, it is. All needs time. All needs, it cannot be done on all of a sudden. You introduce, do the examination, then go for a faculty training. It is not possible for that. So the government should take its own time, and if there is no, the steps should be clear, the hurdles should be cleared, and they should do adequate faculty training, adequate faculty orientation, adequate the classification of the subject, adequate way of giving the students that when the examinations are going to happen. If it is not being done, and then there will be a lot of the mafias, people like there's the coaching centers coming into the play, various agencies coming into play for the coaching will also come. So that all it putting the students into a difficult situation. So I assure on the of Indian Medical Association, we will try our level best, taking into the input of all of you to ensure and lobby with the government to make them understand the difficulty and make sure that PG this next is not abruptly replacing it as in their own time as they have put. It will be phased out in a slow manner. It will be applied to only the people from 2021. It will be come out with the adequate faculty training and faculty orientation has been taken place, and adequate way of examination system is brought out. Then only this next will be allowed. But if it is earlier, it is put in, if it is coming just like that, it is going to be a disaster for the medical college and medical students, because you are always going to be in a tender hook, and even one day, if you are going to take a leave for 2 days, 3 days, 4 days, or if you are unfortunately get into sick, then you will be getting into the problem. So these difficulties we understand, we realize the situation. We want MSN and JDN to be a little more active, proactive, write again and again, bring it in the public, bring it to the newspapers, bring it to the knowledge of the NMC in your own style. So your own social media, your own work should be highlighting these issues, then only it will be able to do. I must thank Dr. Sambat Kumar sir for well explaining how it is going to impact on the medical legal system, how it is going to affect that system also. So in general, though it is a step thing in terms of UK style or US style, but before that, they should clear the level fielding of play level. In India, they should systematize that, regularize it, promulgate the proper rules and regulation. Then only the next should be all. So till then, IMA will also will oppose this, and with all your support, that at least we will get some modification which is shooting to the students, to benefiting the students to get into the proper education and get into the good doctors in the society in the days to come. Thank you very much for your organizing this meeting. I only wish and hope MSN will be sensitized, MSN will take up in a big way, and you will be fighting hard to ensure that we are getting some positive results in the act which has been pronounced.
Thank you so much, sir. Thank you so much for the highly informative speech, sir. Meanwhile, I would like to welcome Dr. Ajay Saha, Chairman, IMA JDN, Maharashtra. If the dignitaries have any questions right now or any doubts from the audience, please feel free to discuss with us speakers currently.
Surya, you can
Yes,
ask attendees to type the questions in the chat box so that we can take up the questions and the answer also. Meanwhile, I would like to, say a few words about whatever already spoken. Particularly, Dr. Jailal had dealt the subject thoroughly. Accordingly, whatever doubts I had raised in the beginning, he also addressed all of them. I think the first few consensus we should arrive that while submitting our suggestions, the next should commence only from 2021 batch. I think that will be very, very ideal. And so it should be, that is number one. Number two, it should be implemented in phases. So we will have to train our faculties so that the faculty importance should be maintained, as I said. Otherwise, all the entrance exam coaching centers will enter into the campuses and will catch hold of all the students and start training them. So we should not allow that to happen. So faculty training should be emphasized very, very strongly because faculty student relationship is very important in one's career. We all know that. And secondly, thirdly, and there are some suggestions that some subjects, disciplines are given only 10%, something like that. That also should be addressed. And fourthly, this PG marks, can be, this examination can be taken even once in 6 months also. Should not, after supplementary is there, of course. Those who fail the supplementary exam, they will have to wait for 1 year. So they may, instead of that, they should be allowed to take it 6 months. These are the things, consensus we can evolve in this meeting. And remain the other things regarding the objective type and regarding the uniformity of the Viva was clinical exam that are going to happen. Regarding which body is going to conduct the exams, all these things we will discuss and take a decision. So accordingly, we can ask people to raise questions and then we will build a consensus on each question.
Thank you, sir.
Thank you so much, sir. The questions are being posted in the chat box and they will be discussed at the end of the session. Moving on to the final topic of today's session, To speak upon the practical difficulties in implementation, I heartily welcome Dr. Shiv Joshi sir, MD, Medical Consultant, WHO NDEP, Convener, IMA JDN Headquarters. Over to you, sir.
Yeah, so thank you, Surya and Raghu, for organizing this wonderful session on Next. I hope I'm audible. Just a confirmation from your side.
Yes, sir. Yes, sir.
All right, great. So wonderful explanations and clarities given by all the speakers before me, especially Abul sir, Jailal sir, Geeta ma'am, and all the other speakers who have spoken before me. I would like to start with a parallel with the COVID-19 pandemic. Like, it's amid the vehement vaccine and waning of the COVID-19 pandemic, we have seen the medical students of this country are engulfed in yet another epidemic, which is the chaos of next epidemic. And as vehement as the COVID pandemic was, the medical profession of this country has conquered it. And so for sure, they will conquer the chaos of next epidemic as well. But the question remains why? The biggest answer that is put forth is regarding uniformity in the medical education, which I think we have been discussing time and again. However, this brings me to a fundamental question before answering that one. Are there the inputs in the medical education uniform enough to test the uniform outcomes of the medical college? Now, before answering this question, it looks to me a bit premature to go on and test the uniform outcomes when we have not made enough attempts to uniform the inputs that we are giving into the medical education, be it in the terms of infrastructure, be it in the terms of the medical faculty, the teaching faculty that is available, be it in terms of the consultants who are available in the medical college, be it in terms of the bed to the teachers ratio or the students to the teachers ratio that is available in the college. Again, it brings us to another important question here. What about the unconstitutional inequity that this exam is going to bring in? Because as we have just mentioned, that not all students are receiving uniform quality of infrastructure, uniform quality of teaching faculties available, uniform quality of facilities that are available to them. It starts from right from the canteen that they eat in to the kind of clinic that they're going to attend, because it depends on how many consultants are available within the teaching facility to actually take their clinical classes to provide this uniform quality of teaching. So there is no attempt there. So how do we go on and start comparing the outcomes, start bringing about understanding the uniformity of outcomes when we have not made enough attempts to ensure the uniformity of the inputs in the medical education? Do we really have unlimited attempts? Time and again in the draft, if you read, it mentions about the students will have no limit on the number of attempts. However, you have to pass your next one and next two within 10 years of passing of joining your MBBS course. So if you join in the year of 2024, by 2034 you are supposed to clear your next one and next two. Now let's try to also understand that from the joining of the MBBS course, okay, not from the first time that you are eligible for the next one. It is from the joining of your MBBS course. So if you join in 2024, you have to clear both next one and next two by 2034. And even if you don't want to go ahead for your post graduation, or if you want to just be a general practitioner, or you want to go somewhere, you want to practice in your village or something like that, you still have to qualify these exams, because otherwise you may get a degree if at all the amendments come from the UGC Act and the Indian Degrees Act. If they come forth, and if the university still goes on, gives you the degree on the basis of the exam that some other board has conducted for you, still the question remains, why do I have to give this exam? I mean, if I'm no longer interested in pursuing my post graduation, India in itself requires more numbers of general practitioners, family medicine experts, as compared to the highly specialized cadre of medical profession. While both of these cadres are equally important, considering the fact that most of our patients will require care that can be provided by general practitioner, considering the population that we are catering to, is it a wise move to again go towards an exam which has a very skewed kind of focus on clinical subjects? That remains a question. Again, there are some more, what I will say is that this basic context brings me to certain key gaps and challenges which I wish to put forth in front of this esteemed battery of of speakers here and the vigilant attendees of today's session. First and foremost is, what about the training of teachers? Geeta ma'am has rightly put forth, Jaila also spoke on it. Almost all the faculty have touched on this point. We have seen that there has been a very fancy proposition to supposedly improve the quality of doctors by bringing in competency-based medical education. But when we talk about competency-based medical education, how many faculty in the country right now are confident in teaching competency-based medical education? Unfortunately, at a lot of places, what we have seen that is practice, that has been noted by the students, is that the same textbook has just been divided into competency-based objectives. So there's nothing new about it. So you are just reading the same text under different headings, because now it has become one of the competencies. But if you look at the Miller's pyramid, it doesn't just focus on the knows and the knows how, it also focuses on the shows and the shows how, which is an important component of the existing method of evaluation of the medical profession. How do we exactly incorporate that by using NEXT? Because we are going to rely absolutely on either a single best answer or multiple best answers as proposed in the draft. It can be a single best answer or multiple best answers that are possible in the multiple choice questions. How do we basically assess this kind of understanding of the subject based on MCQs? That remains a challenge. As put forth, if we are talking about uniform outcomes, we also need to think about uniform infrastructure, uniform teaching faculty. Can we, in our sane minds, compare the skill labs, which actually all the medical colleges are supposed to have? Can we compare a skill lab in the government medical college with that in the AIIMS? Can we compare that? Can we compare the same skill lab that is available in the government medical college, AIIMS, and some another deemed university? Can we compare the skill labs existing in different government medical colleges and different AIIMS in itself? So when there is no uniformity or no attempt to ensure that such uniformity exists across the country, why we are behind testing the uniformity of the outcomes? That remains a question. It seems to us as a glaring reality. We are looking at a government or the move by the government that instead of taking the responsibility to improvise these structural gaps in medical education, which comes in form of the infrastructure, the beds, the teachers that are available, qualified teachers, as mentioned by one of the speakers earlier. Teaching itself is a profession, but how much of the effort have we trained all the medical teachers in this country in different courses that make them the different workshops that make them better medical teachers? Not really. And if so, have we ensured the uniformity of such trainings? Not at all. So instead of taking the responsibility to improvise the structural gaps in the medical education, government has found an easy quick fix by testing the uniformization of the outcome without so much of the focus in the uniformization of the input in terms of the infrastructure and the faculty and the skill labs and number of other things that is being proposed in the guidelines. But we know how much of that is actually existing in the field, and even if it is existing, how much of that is uniform. It also makes me believe that it is an unnecessary exam to stagger the pace of doctors coming out in this country, and it will again lead to facilitation of different coaching predators who will try to again now capture the MBBS students very early, right from their first years, probably the first day of their medical school, to start preparing for the next one, which to me looks further deteriorating than to improvise the medical education. So while the move is welcome, you have brought the next, while the move is welcome, while it seems that the agenda is about, or the intention is about bringing the uniformization in the medical education, it still feels that there is a very significant amount of gap in the attention to the details that has been put in while generating the draft for next. It also makes me believe that the current proposition of next is killing the analytical understanding of the subject, and we are tending to create algorithm based robots. So let's just take an example. Okay, I'm a person from community medicine. I'm working with WHO as an epidemiologist. Like, I'm a medical consultant. So let me take that aspect into evaluation. A very basic question, like, critically evaluate that India is a nation within nations. What are the implications of this on the health policy planning in the country? How can I replace this question with an MCQ? Is it even possible to capture that kind of analytical approach? Is it even possible distantly to capture that kind of critical understanding of certain areas within a subject? I don't see so. How can we integrate 10% of subject like maybe community medicine to each of these clinical subjects? How that is going to work out, I don't understand. So if you're just going to put the program that works in the disease, that doesn't make you competent enough in the subject. So that again is a question mark. So are we just trying to create algorithm based robots? Okay, if there is A, do B. If there is B and C, do D. If there is D is absent, do F or E. Like, what kind of doctors are we creating? Where is the scope for assessing that analytical approach of a doctor in this assessment scheme that is proposed? And the last question that comes to me is that it feels that it is yet another fancy proposition, just like CBME that was introduced with no genuine thought into the implementation of the process. CBME is a wonderful idea, but on the field, if you go and see, there are significant gaps. The teachers, they just know the competencies, they don't know how exactly to assess it. We are talking about OSCE. OSCE has become such a mundane ritual in the medical colleges that the student will already have that 10 steps beforehand, before the exam, and he or she, without even understanding what that step is, will just do something around that step, and we start feeling that okay, we are doing OSCE. But that level of rigor still needs to be instilled within our teaching faculty as well as the students, to make them understand what the purpose of OSCE is. And that kind of thing needs that training of trainers. That kind of thing requires time to create that adequate infrastructure and training facilities so that we can facilitate the assessment of students in those areas. Finally, Dr. Hariharan sir has very beautifully compared our exam with the developed countries, an exam like USMLE, which is the most similar exam as is proposed. And I cannot help but see next in light of a very sad attempt to mimic the exam pattern of the developed countries without mimicking any of the efforts that these developed countries have put in teaching or training their teaching faculties, in creating absolutely fantastic infrastructure for the medical students. There, that kind of mimicking is not happening, but we want to mimic the licentiate exam, and as very rightly put forth by Jailal sir, in its given form or the current meagerness of the details that the proposal for next that it provides, it is impossible for it to be at par with international exams like USMLE or PLAB or Australian licensing, anything you say. It's very difficult to put it at par with such exams, which has a lot of different components. Next is also compromising a lot on the formative assessment. It is basing everything on a single summative assessment, which will decide whether you get the license or not. So there are all these glaring issues that I think are the practical challenges and practical issues that will require a lot more thought than what this 9-page draft of next proposition has come forth. And I think it's a wonderful opportunity, and I thank this entire team of IMA MSN and JDN to create this platform for further discussion on next. Thank you. Over to you, Raghu.
Thank you, sir. Thank you so much. And Surya.
Yes. Thank you so much, sir. If there are any other questions from our dignitaries, I request our dignitaries to discuss them now to our speaker. Okay, since we have no queries, I would like to move on to the audience question session. Since we have a time constraint, we shall only be addressing 4 questions for now from the audience. The first question being, how to integrate and study forensics with other subjects? I request Dr. Sampath Kumar sir to answer this query.
Yes, sir. It is very difficult. In fact, am I audible?
Yes, sir.
Yes, sir. Yes, sir.
To integrate with other subjects, as our MGR University VC said, we love to study, say, forensic orthopedics, forensic surgery, and forensic psychiatry. Like that, we love to integrate right from anatomy. So it has to be done on the due course when the student joins. So it not only the ethics has to be told up to level of psychiatry, forensic psychiatry, forensic dentistry, everything has to be integrated. Even in a case of a cardiac module, the causes of sudden death, the medical legal implications has to be told to him in a medicine also. So everything has to be integrated right from the beginning. It cannot be integrated at the level of a final year now for the student. So when he joins itself, it has to be introduced for each module when they start. And for example, about the heart, the embryology, that time itself, apart from embryology, the physiology of the heart, then the medical legal aspects of sudden death, it has to be completed. So it needs a lot of training on the faculty part, or it has to be integrated right from first year to final year for them to handle the students. Hope I'll be clear.
Yes, sir. Yes, sir. Thank you so much for answering the question, sir. Up next, we will move on to the second question being asked by Dr. Betsy Thomas. If a student fails in next one, the average of 3 consecutive exams will be taken. Does that mean that he has to write 3 times? Is the question. And I request Dr. Kanagasabai sir to answer this query.
No. It's not. He has to appear only once. If he fails the exam, there is a supplementary exam within a month. So he has to appear for 1 exam. Thing is, only for the improvement, they have given a statement that if he goes for improvement, 3 averages will be taken. That's not clear, I told. Am I clear?
No, there is a lot of questions on that. When you say the 3, you have to take an average, and in between what year?
For the failure, only 1 exam. He has to pass through the other exam, supplementary exam, after 1 month. If he fails in the supplementary exam, then he has to go through next year, 1 year.
Only
That's
2
what
attempts,
Professor...
and how you are going to take? Yeah,
Pardon?
this is. I'm Jailal. I am not able to be seen because I am in the car.
Yes, please.
Okay. No, that average of 3 exams is again a big problem because it is not talking about what is the gap between the 3 exams, whether it's a consecutive exam they are going to take, or whether it is going to be take, because within 10 years he can complete. So that clarity is not there on that pattern. But as
that is for
said,
improvement. That is for improvement only. That is not for passing, and that is for improvements.
Okay, that is for improvement. Yeah.
Improvement, that's for improvement. For passing is only 1 exam. The questionnaire for the student is asked whether for failing students, whether he has to appear 3 exams. For a failed candidate, he has to appear only once.
1 exam. That is true.
1 exam, supplementary exam. As you rightly point out, if he fails in supplementary, after 1 year.
That is a big challenge there.
Yeah, big challenge. Of course, I do agree with your version. 3 or twice or thrice should be conducted.
Thank you so much, sir, for answering the query. The next question is directed towards Dr. J.A. Jayalal, sir. Asked by Dr. Sugandhi Bhattacharya. Question is a 2-part question. First part asks, should be implemented first for MBBS batch 2021 to 26. And the second part of the question asks, What will be the licensing system and PG selection procedure for batches admitted prior to 2021? So
no, that's what the act says. It's only till the full blown NET is coming, the commission or the government has the right to decide upon that. What the internal information what we are getting till the 2021 batch is coming into the full blown next, and simultaneously both this will be happen. And the students who are now till up to the 2019 batch students, they will be allowed to write the exam, registration will be happen, and they will be writing the NEETPG simultaneously. Only from 21st it will be coming as an simultaneously. There will not be any NEET after that exam. That is only consensus now arising, but yet the final word has to come from the NMC.
Am I permitted to answer, please? If you can supplement some,
yes,
some
sir.
answer.
Yes, sir. Yes, sir.
See, I told in my speech itself on page 3 of the document, the NMC has given the use of scores and normalization of different examination, and the next shall be determined by the commission. So they have not yet decided how much weightage is to be given. Suppose a person who has already passed his NEET exam, PG exam, how much weightage has to be given, that the commission will decide later. And the year of implementation is yet to decide, not 21 batch or 20 batch. They are yet to give clarity on that. Thank you.
Thank you so much, sir. Thank you so much.
Surya,
moving on to the next. Yes, sir.
Surya, with regards to the improvement, since the subject already brought in, I think
Yes,
I should suggest instead of the average of 3 scores, we should suggest them to take the best score.
Yes,
best
highest
score
score,
of the
highest score.
improvement exam. Yeah,
Correct, sir. Highest
yes.
score.
Highest score.
Yes, sir. Thank you so much, sir. Moving on to the next question. This question, I request Dr. Abul Hassan, sir, to share his thoughts on. This is a scenario where it was given by Dr. Stephen Seiler. The disease prevalence differs in different parts of India. Most teachers teach more on the diseases prevalent in their localities. If a student is sent to the other centers and he is asked on a disease which has never been taught to him, it will be totally unfair. So I request Dr. Abul Hassan, sir, to share his thoughts on this statement.
Definitely, this is one of the practical difficulty. For that, the solution would be to train the faculties. Because the objective is to have the uniformity in the examination. So must be there should be uniformity in the education also. So everybody is needed to know about every disease, whether they are prevalent in that area or not. They should know everything about everything. So I think this can be addressed easily by educating or training our faculties to cover all the disease. So there should be uniformity in education. As Shivu has had emphasized, that there should be improvement in infrastructure and also teaching, and other faculties also said the same. So I think this should not be a deterrent for, say one basic thing is government wanted to control entrance gate and also the exit gate. Now they have controlled the entrance gate by applying this NEET UG. Now the exit gate also they want to control by applying this next. Fine, it is fine with us, and of course they are listening to us to have the very good draft covering all subjects. So particularly this issue can be addressed by a kind of training and bringing uniformity in the infrastructure, uniformity in education. Over to you, Suresh. Sorry, Surya.
Thank you, sir. Thank you, sir. Thank you, sir. I would like to thank all the eminent speakers for enlightening us about next examination. Since we've come to the end of this session, I'm sure this webinar would be of great use to all of us in the nearest future. I now request Dr. Raghunandan Ramanathan to deliver the concluding remarks for this session.
Thank you so much, Surya, for hosting it very well. And I would like to thank all the dignitaries over here. Out of your busy schedule, you're here to help us in clarifying the notification issued by the National Medical Council. And I feel immensely gratitude to all the speakers who are here out of their busy schedule, right from our Dr. Geeta Lakshmi ma'am, Vice Chancellor of Dr. MGR Education and Research Institute, Dr. Kanakasabai sir, retired DME, Dr. Sampath Kumar sir, Professor Annette, Department of Forensic Medicine, Savita Medical College, and President of Tamilnadu Medico Legal Society, Dr. J.A. Jailal sir, past National President of IMA Headquarters, and Professor Annette, Department of General Surgery from Kanyakumari Medical College, and Dr. Shiv Joshi sir, again convener of IMA JDN Headquarters, and my own brother, Dr. Venkatesh Karthikeyan sir, who is like very much like with me in starting from organizing, selecting and requesting the speakers to making this event happen. And I would like to always thank my mentor, Dr. Abul Hasan sir, who is always supportive, who encourages our ideas. When we first put forward the idea of this webinar for this next exam, since many students from different medical colleges were approaching our IMA MSN Tamil Nadu regarding the next exam and the clarity regarding the next exam. And when I approached Dr. Abul Hasan sir, he was like telling me, he gave me a free hand to right from the selection of speakers to the finalization. So I thank you so much, sir. And it was his idea to invite every, not only limiting to the state of Tamil Nadu, but receiving the registration from all over the country, so that it will be useful for everyone, those who have doubt regarding the next exam. So thank you so much to all the dignitaries who have come here. Thank you so much, sir. And now I would like to...
Raghu,
Yes,
1 minute before ending, I would like to ask you one assignment.
Yes,
Yourself, Venkatesh and Shiv Joshi, please join together and make a draft of whatever suggestion we had discussed. And then it should be circulated to all the faculties who have spoken today, and get some addition, deletions also from them. And then we will submit to the headquarters.
Sure, sir. Sure, sir. We will do that definitely, sir. And thank you so much once again. So let's have a more number of discussion in future regarding next, as well as regarding the other topics. IMA MSN Tamil Nadu as well as JDN is planning for even a career guidance session in all the fields of medicine, as well as regarding the how to ace the university exam, final year exam. So we are planning everything and we are looking on to it. So I request all the dignitaries to provide us the same support you are giving us for this wonderful initiative. Thank you so much, sir.
Raghu, one more news is tomorrow morning we are sending a letter to the Union government to postpone the date of eligibility for NEETPG this year. The students who write NEETPG exam. I have spoken with the Dr. Sendamil Pare and the state office, and we are doing it tomorrow morning.
Thank you, sir. Thank you so much, sir, for this positive news, as we have emphasized before this event or before this webinar to Abul sir regarding this NEETPG issue which is going on. I think this will be a great step which will be helping for the students of Tamil Nadu as well as for other states too. And once again, thank you, Jailal sir, for joining with us today in spite of his schedule. He has consented to be a part of this webinar and give his valuable suggestions. Thank you so much, sir. And thank you once again to all the speakers. Thank you so much, sir. And finally, I would like to thank Clarinet because organizing this webinar with almost like 1,500 plus registration, mailing them continuously to join, and everything is technically it's difficult, and they have made easy our task. And thank you so much for that.
You're welcome, and thank you everyone today for this informative session. It's you who make it's like you people who make our platform, like matlab, like go to our like motives, our targets. We hope to see every one of you very soon with another topics, as you were saying, discussing it. We are very proud to be the digital partner of this session, and this was just what we needed, what our platform needs. So thanks a lot to everyone once again.
Thank you, sir. Thank you.
So,
thank you, sir.
So with all your permission, we'll conclude the session today as of now.
Yes, sir. Sir, shall we conclude, sir? Bull, sir?
Yeah, please. Thank you. Thank you,
Okay.
everyone. Thank you, Shiv, Jalal,
Thank you,
all
sir.
the faculties.
Thank you so much, sir.
Thank you,
Thank you.
everyone.
Thank you. Thank you.